Chest physiotherapy, moving and loosening secretions. Chest physiotherapy is the application of several specialized techniques used singularly or in combinations that promote effective coughing, removal of secretions, and unobstructed breathing. Techniques that may be used is pulsal drainage, percussion, vibration, coughing using several positions, and other airway clearance techniques. Pulsal drainage is the technique in which the student is placed in specific positions during the day for specified periods of time. By positioning the student in certain positions, mucus is forced by gravity to move from the various sections of the lungs down to the bronchioles and bronchi and into the trachea, where they can be removed by coughing or suctioning. There are several positions to be placed in. This should not be scheduled immediately before or after a meal. Treatment will usually last approximately 20 to 30 minutes. So these are all the different positionings. When trying to drain the upper segments of the lungs down into the main bronchi, the student is usually placed in a sitting position. When trying to drain the anterior segment of the lungs into the main bronchi, the student may be positioned flat with a pillow under their knees for comfort and support. The remaining positions have the student lie tilted downward to drain secretion from the lower lung segments up toward the trachea. The next technique is percussion. This technique is also known as clapping, which is performed during pulsal drainage. Clapping typically uses a cupped hand to gently strike the person's chest in specific places over the underlying lung to hasten drainage by shaking secretions from the sides of the respiratory tract. When a cupped hand makes contact with the student's chest, an air pocket is created to cushion the blow and transmit a shock wave into the lung. This is not a painful technique, and typically a student is percussed for 1 to 2 minutes at a time, then encouraged to cough. It is also important to know that personnel and students understand that the student is not being hit, but is having special health care techniques performed on them. The next technique is vibration. This is a technique to help move secretion into the main airways. It's the application of fine shaking motions during exhalation over a specific area of the chest with a flat hand. This may be performed manually or with a handheld vibrator. In a hospital setting, more powerful vibrations may be used. This may be ordered to be given after pulsal drainage and percussion or used independently. When following pulsal drainage and percussion, it's usually delivered 1 to 2 minutes after percussion is completed. The next one is coughing. So this follows any of the other previous techniques that I just talked about, so coughing should be encouraged. The person should ideally be sitting in a sitting position when coughing. There are several deep breaths should be taken, and then within the last deep breath, a deep cough should follow. Students 3 to 4-year-old or older are encouraged to spit out the secretion rather than swallowing them, even though it doesn't hurt them if they were to do that. Spitting out the secretion allows the caretaker to monitor the amount, color, consistency of the secretions as well, which is important information when monitoring for respiratory infection. Typically, it is expected that some students may swallow the mucus secretions, but if the student cannot cough effectively, then suctioning is usually ordered.